Hello, 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 everybody. Hello, everybody. Good afternoon, everybody who is already there, who is already started giving us those likes. Thank you, every single one of you. Thank you for being here. Go JB Health is right here with you.
Go JB, go JB, go JB Help, go JB, go.
Thank you for all or to all my friends who are already giving us those likes, the people who started sharing already. Thank you, my friend K Shell, for saying this is great info. Say you're very welcome today. And thank you for my other friend who said great Friday to you as well, my friend. So go JB Health. We're gonna have a great show. Okay, very well, very well. Thank you. If you could hear me loud and clear, thank you very much for being here. Again, once again, I'm here. My name is JB. I'm a family nurse practitioner. I'm here to do a health education show. Every day, I'm here to spend a great time with a lot of friends who are being very supportive of what we do. So, today, again, once again, we are here. We are going to talk about some great stuff, great information. Again, if you just join, we encourage that you follow us so you know whenever we are live the next time. This show will be played on our YouTube channel. Again, if you have not followed us or subscribe on YouTube, we appreciate that you do that. Thank you for the people who already tapping on the screen to give us those likes, those shares. Thank you very much. Thank you to all my friends here. I already see a lot of people that I know. My friend Kelly, how you doing? So that is good. That is good. My friend Kelly is saying know your numbers. It's probably she's already helping me answering some of those questions that are being posted on there. Again, guys, as I said, thank you, my friend Heaven, for being here, and thank you for sending me that finger heart. I appreciate you, my friend. Thank you, my dear friend, from the bottom of my heart. It means a lot to us, my friend Heavens. Thank you very much for every one of you who is already connected to this platform, for this great educational platform. Again, with your support, we could educate as many people. If you guys look on our page, we have a lot of information, all of it about educating people about healthcare. Again, if you have not followed us on YouTube or Twitter or Instagram, please, we encourage that you do that, because that's a way to grow those platforms as well and make this educational information. I'm sorry, guys, you know I speak French, so sometimes my French is trying to overpower. But anyway, that educational information, make it available for as many people as possible. Again, as I said, everybody who support us, everybody who gives us likes, everybody who is there to support this effort. Thank you, my friend Nikki Klein, for being a new follower. And any type of way, whether you are a subscriber, whether you just giving us those likes, we appreciate everyone. Thank you for the support, because again, you supporting us is a way for us. I need to fix that. You supporting us, it's a way for us to continue to provide more great information. It's a way for us to continue to educate more people. Again, if you just follow, we appreciate you. If you just join, if you have not followed yet, my friend Heavens is giving me that big cup. Thank you, my friend. I appreciate you. Thank you very much. Thank you for giving us this big cup. Actually, it's called MVP Award. Thank you very much. This is my first time receiving this award here on this platform from my friend Heavens. Thank you, my friend Heavens. Appreciate you. That means a lot to us. And thank you also for liking this video. Again, this show, we do it every single day, Monday through Friday. We are live every day from 1 p.m. Eastern time. Usually we spend about an hour and a half together. So again, if you are, thank you, my friend Juliet, who just got here. Hey, my friend, my dear friend, thank you for being here. I'm very happy to see you. So if you miss any part of the show, just keep in mind, my friend Bamus, who just became a new follower, if you miss any part of the show, just know that it will be available on our YouTube channel. So once we finish the show, we load it on our YouTube channel, so the people who missed part of it or the people who didn't get a chance to be part of it, then they are notified and they are aware of, they know that it's there. So yes, so we are very happy to be here. We are very happy that we are here. But today we will be talking about this very, very important thing that may be related, but a lot of you guys may relate to. We will be talking about anxiety. I mean, among everything else, because again, as I said, we answer a lot of questions here. So when we hear, oh, my friend 7 point stars, I have not seen you in a while, my dear friend. Thank you for being here. So my friend here is asking, can UTI result in someone having hands and leg weakness? Not necessarily. So again, if you have UTI, usually UTI is not, this is not one of the most common signs of UTI, unless you get that UTI to get into making you having a very bad infection, like a systemic infection. I could see you having symptoms like this, but usually UTI doesn't really cause hand and leg weakness. Actually, if you have hand and leg weakness, now it is very, thank you, my friend Juliet. Thank you for your support. I appreciate you. So, actually, if you have hand weakness, now it may be very important that you get this checked out, because now I'm worried whether it's something to do with, because hand weakness or leg weakness could be sign of stroke, which is an emergency that would require for you to immediately call 911. Again, I'm not here to scare anybody, but what I do, I educate people, and I have to tell you the truth. I have to tell you what I think is the most, or is the safest thing for you. So really, that's all I do. So if you think you have leg weakness, hand weakness, that may be an emergency. You need to be looking for medical attention immediately. You need to be looking for help, because if you tell me you have hand weakness, and again, you are at home, you're not here in my office, so it's very hard for me to tell that you are not having a stroke. So if you have this, please, my dear friend, please go to the emergency room. Again, UTI usually, the sign of leg weakness is not a sign of UTI, just so you know. I have a lot of new people following us. We appreciate every single one of you. My friend here says, I have a white count of 14. Well, if you have a white count of 14, for those of you who do not know, when your white cell count is elevated, again, remember we have some subject here where we talk about we talk about some of the issues where we have autoimmune issues, or when we talk about issues like HIV, where we talk about your defense system. Remember, your main defense system are the white cell count. So when we check your blood, and this is something we're telling you here, that's cool education, understanding. This is what we call the understanding of your own body. So when you go and you have a elevated white blood cell count, what does it mean? Well, the meaning of this, it means that possibly you have an invader. When you have an invader, what happens? Your body multiply more soldiers, I would call them, in quote, more soldiers with more of your defense system is mobilized to fight that enemy that is trying to kill you. We're talking about that bug that is trying to make you sick. So usually that's the reason a lot of the time people will have that white cell count. Again, if you are new to this, we encourage that you follow us. Again, plus if you miss anything this evening, it will be, once the show is over, we will load it on our YouTube channel at Go JB Health on YouTube, so you will be able to watch it. But if you're new, we encourage that you follow us so we could know where we at. So the thing is, when you have elevated white cell count, it may be a sign that you are having infection. So I'm assuming that if you tell me that you have elevated white cell count, it's probably because you went to your doctor. So now if your doctor told you your white cell count is elevated, so obviously what's the plan? So what did they tell you they're going to do? What did they think causing your white cell to be elevated? Again, there's a lot of infection you could have. It could be upper respiratory infection. It could be UTI. All these sometimes can cause you to have elevated white cell counts, such as kidney infection and things like that. They could always cause you to have a white cell count. So my friend here, my question for you is, what is the plan? What did they say? What is the reason for that? I was trying to explain to you why your cell count is elevated. It is not normal. And again, for some people, it may be constantly slightly elevated, saying if you come here, your blood cell count, your white blood cell count is a little elevated, and I'm checking everything. There is no signs of infection, and I keep checking it. It's continuously always elevated, and you've been okay. Then we could say it's something that may be more like a normal for you specifically. But if your doctor told you that your white cell count is elevated, then we need to have we need to know what we do. I don't know my white count. So then if you don't, then what is elevated? When you say 14, what is 14? Are we talking about A1C? What are we talking about? What is the 14? Please, my friend. What is the 14? Because I was assuming that we were talking about white blood cell count. So anyway, so that's a good thing, though. We end up having an educational session about white blood cell count, which that wasn't the plan. But again, when we do this show here, what we try to do, we make it different, where we don't focus on that one little thing, but we try to answer as many questions. Hello, my friend Fatmata, how you doing, my friend? It's been a while that I have not seen you, but thank you for being here. I see you here. Thank you for being here. Again, if you just joined, we encourage that you are liking, like my friend Sweet, who are pushing the like button on this show. So I appreciate you. I appreciate the people who are sharing as well. So again, if you just joined, this is a platform where we talk education. If you are not a follower yet, we encourage that you follow us, because when you follow, it allows you to know exactly when we are live the next time. But if you miss anything on the show, it will be available on our YouTube channel. As a matter of fact, several of the shows that we completed, they're all already on our YouTube channel. Thank you, my friend Shantella Tris. Thank you for being a new follower. We appreciate you. Thank you for joining us. My friend Cotton_Candy in the house. Hello, my friend Cotton Candy. Thank you for being here. Good afternoon. Thank you for being here. And I have my friend Sweet, who keep on pushing that like button. We appreciate you very, very much. Santeltris, thank you for the little heart. Thank you for the support. Again, Cotton Candy is liking the live as well. So guys, thank you for being here. Now, we are talking about anxiety. Anybody here ever have issue with anxiety? Well, anxiety is one of those things that could really make messed up our life. It could change the person we are. It could change a lot of things in our life. Thank you, my friend, my sweet friend, Sweet Shreddy. Thank you for the roses. Just give me 9 roses. My friend Sweet Shred 46. Thank you again for being here. Thank you for the support. I love the roses. Thank you, my friend. So the thing is, if you are when you have problem with encourage my friend Cotton Candy, thank you for giving us a rose. Appreciate you very, very much. Thank you very much. Nancy is saying that my friend Cotton Candy is giving us 5 more roses. Appreciate you, my friend Nancy. Thank you for being here. I'm glad you're here. My friend Cotton Candy just give us 2 lollipop. Thank you, my friend. I appreciate that. I appreciate that very, very much. Again, today we are focusing on talking about so my friend Sweet Shred giving us more love. 11 roses from my friend Sweet Shred. Thank you, my dear friend. A lot of appreciation for you. Thank you for and actually she didn't give me, it was the TJ gift that she gave me 11 of. So thank you. So you have a question, my friend. What is your question? I'm here to answer question. My friend user 48 in Texas. My friend in Texas, how you doing? Thank you for being here. We are glad that you are here. We are glad that you are connected through this platform. We are very happy to see you. So what is your question, my dear friend? Again, today we are talking about anxiety. So first thing we're going to look at is, what is one of the most common signs that you may have if you have anxiety that may suggest that you have anxiety? Well, anxiety, some of the most common signs that you're going to have is lack of sleep, So you may be not be able to sleep at night. Your heart may be racing. You may be very anxious, so you don't have no patience with nobody. Sometimes, again, anxiety and depression are very connected. So sometimes too, you may have some of those same depressive symptoms, such as you want to sit on in your little corner by yourself. You don't want to be hanging out with people. You don't want to be annoyed by anybody. That's how they usually say. So high count and white cells. So okay. So my friend Woofo Woodolph, thank you for being a new follower. We appreciate you. We appreciate you very much. Again, my friend Fatmataka, thank you for keep on liking this live. We appreciate every one of you guys who are here, who are already supporting. So if you have somebody that you are around them and you suddenly they start not wanting to do anything for themselves, they start being very irritable, I should say, they are not able to sleep at night, they are having like their heart is racing, so they may be suffering from anxiety, depression. Again, I'm gonna link it with depression because those two usually they go hand in hand. Or you have somebody who used to like to do things, they were very social, they wanted to do things every time, but now all of a sudden they don't want to talk to nobody, they don't want to do anything. When you invite them to something, they're like, well, I'm not interested. This person may be having anxiety. So anxiety, this problem there, if you don't make sure you take care of it soon enough, then it could develop to a lot of other conditions, a lot of other symptoms. It just get worse. So that's why we are talking about here. So my friend here say, I have social anxiety a lot, get nervous around people. Yes, so there's different type of anxiety. So some people may have social anxiety. There's different situations that people may be in that could cause them to be anxious. So that's why we have different type of anxiety. What to do? Just saying, why does any anxiety heart?
Go JB, go JB, help.
So yeah, somebody else here say yes, they have anxiety too. I'm sorry. So if you have anxiety, what happens is, saying if you come to a primary care provider like me, if you come here, what we do is to try to put you on a medication to help you with anxiety. Again, you could be on something like an SSRIs, can help with anxiety, but also we have medication like Buspar, can be a good medications to help you with anxiety. Now they could go to some of those control medicine, which we don't do here in this office, but thank you, my friend Fatmataka. Thank you in the house, giving me 17 roses from my dear friend. Thank you very much. Yes. So you could have some of those benzos, like my friend here saying they are taking Celexa. Yeah, that's a good medication. So those medication usually, as a primary care provider, will start you on this medicine, and if we feel like it is not helping you, then we may have to refer you to more mental health to make sure you get the proper the proper medications or the proper care. But one other thing that is very, very good for any of the mental health issues is therapy. So therapy, I understand a lot of the time when people heard the word therapy, they always think, oh no, I don't want to see a therapist. No, I don't want to talk to a therapist. But therapy is not or should not always be a negative thing, because again, therapy, all it is just having somebody who may have some experience or may have seen other people dealing with your same issue that you're having. All these people are doing is sitting with you and try to help you find better ways to cope. Again, it could be better ways to cope with depression, with anxiety, with any of the mental health issues that you may have. So those therapists, they are trained to have a conversation with you and help you to have a better rationale as far as making decisions, as far as doing certain things. So then you don't end up doing things that are not good for you. So, and they also teach you on best ways to relax, best ways to approach those thoughts that you're having, those feeling that you're having. So really that's a great thing to do, actually, because a lot of the time without therapy, when you just take a medication and you don't do therapy, and again, I'm not talking about somebody who has a very tiny little touch of anxiety, but so mental health isn't automatically recommended when starting antidepressant or anti-anxiety med. Well, so if you are taking, well, the thing is, mental health are the specialists to deal with those issues. However, most of the primary care office, like this office here, we are able to at least start you on some medicine. And a lot of my patients, I'll start them on something like Paxil, and then they do pretty well. I start them on Buspar, they do pretty well. So if they do well, then I do not have to be escalating it to mental health. However, my point was, if I'm giving you this medication, so remember guys, I'm very big with people taking something that works for you, not just taking it for saying you take it. So if you taking this medication and it's not really working for you, so my job is to actually refer you to mental health so they could come up with better plan to help you, you know? So my friend here say, yeah, my friend here with social anxiety, I will just like it's nobody in the room. So yeah, so I do know a lot of people like this. Hello, my friend Dallas. Hi, who you doing, my friend Dallas? Thank you for being here. We are very appreciative of you being here. My friend Robin, thank you for being here. Good afternoon. Again, everybody, if you just join, we encourage that you follow us. Hello, my friend Anna. Thank you for being here. We encourage that you follow, because when you follow us, it allows you to have a notification whenever we are live the next time. However, if you just join, no worry, because this live, the whole life will be loaded on our Facebook page at GoJB Health on YouTube. So it will be on YouTube, so you will be able to I think I said Facebook page, but it's mainly it will be loaded on YouTube. So if you go to our YouTube channel later on, you will be able to see the whole thing, everything that we talk about today. I'm doing pretty well, my friend. I'm glad that you are doing well. Thank you, my friend TMC 391. Thank you for being a new follower. We appreciate you. Thank you for being here. So it's a lot of people with anxiety issues. It's a lot of people in our community with these problems. And I'm planning on, as I told you guys, I'm trying to bring other people to this platform so they could be able to help us expand their education. So some of the specialists, I'm also planning on bringing somebody who is a mental health specialist here, so that could talk, where we could discuss maybe a couple of the mental health issues, where it will be more a presentation. Yes, we will still answer questions. My friend Queen Victoria, how you doing? Thank you for being here, my queenie. We are glad that you are here. So all I can take is painkillers. Okay, so I'm sorry. My anxiety was brought by yeah, a lot of the time, sometimes people just started, they never had an anxiety issue, and it just started happening based on certain event or something that happened to them, and they start having anxiety issues. Again, I have to take a minute to thank every one of you, the people who are tapping on the screen to give us those likes. We appreciate every one of you. We want to appreciate the people who are subscribers to this platform, and the people who are sharing this live. We have a lot of people. We want to thank a lot of of our friends here who went over and be a subscriber on our YouTube channel. We want to appreciate that as well. So again, as I said, what I'm doing here, I can only continue to be successful in it if I have the support of everyone, if I have the support of everybody who is there. My friend Anna Lisa, you put a question mark. Do you have a question? What can I do for you? What can I answer for you? My friend, the support of people like my friend Juliet, who just gave us a tea gift. So I appreciate you. Thank you very much. So all these people who are supporting us, that's how we are able to do this. So the YouTube is at go_JB Health, pretty much the same name, at go_JB Health. You should be able to reach us on YouTube, my friend Sweet Red. We have a lot of things that we post on there. For my friend who asked about PTSD, we do have a video on our page, on our platform, that is talking about PTSD. When you look at it, if you have any more question about it, just let me know. So I am going to subscribe now. Well, thank you very much, my friend. Actually, it's gonna send me a notification right here while I'm here. It will tell me that you are subscribed. So I appreciate you. Thank you very much for the support, and thank you for tapping on the screen. We appreciate that. So and my friend Fatmataka, you did ask me a question. I'm sorry, I probably missed your question. And what is your question, please? Again, guys, it's a lot of questions. It's a lot of comments going through here, so sometimes I may not so my friend Champagne Harris, thank you for being a new follower on Instagram. We appreciate you if you're on part of this live, by the way. So the thing is, we have a lot of those things that are already answered on our page. So sometimes it's if we may missed it, and if we missed it, please forgive us, because if we are trying to answer every single little questions, sometimes we end up not getting chance to talk about our topic. My friend there has depression. I'm sorry. Alicia, thank you for being a new follower. Bev Cam, thank you for joining. We are happy to see you. You know, we always happy to see you as being part of this platform. Joyce, thank you for joining. Thank you for joining. Sherry, thank you for being a new follower. Again, my friend Champagne, thank you very, very much. Appreciate you. So again, anybody, if you just joined, we encourage that you follow us. But also, if you miss part of this show, no worry about it. My friend Bev Kim, who are giving us roses, thank you, my dear friend. No worry about it, because we will have this loaded on our YouTube page later on today. So again, if you ask a question and we missed the question, we always go back and look at some of these questions and create videos to post on our page. So on our page, we post at least 1 to 2 small short videos that really teaching you about something, usually about health prevention, about health education, about better ways that you could understand yourself. As I said, usually I call it teaches you to be the better mechanic of your body. Thank you for everybody who is tapping on the screen. Thank you for being here. I have Sexy, thank you for joining. I have Ria, thank you for joining. Philip in the house, thank you for joining. Ria just became a follower. We appreciate you. Kelly, thank you for liking. We have Moba in the house. M. Bentley, thank you for being here. Kelly, thank you for sharing. We appreciate all of you guys who are pushing on that screen. We appreciate every single one of you guys, like my friend Bev Kim, who always support what we do here. So we appreciate everybody. My friend Sweet Tread for giving us roses, for sharing, and I believe she will be going on YouTube. Can someone pin the YouTube, please? The YouTube, maybe my friend Juliet, if you're there, can you pin the YouTube on there for us? My friend Juliet, if you are here, can you pin the YouTube? It's you have to put the @ sign, because I found that it's easier to find it that way. It's at go_JB Health. That's what it is in YouTube, and if you type that, you should be able to pull it up. So again, if you have not followed us on YouTube, we encourage that you follow us there. It's about the same education, but what we do, we put every time we have the live video, we go ahead and post it there. But sometimes also, because every one of those different platforms, they have different requirements. Some of those education may be a little slightly different depending on the time, etc. Thank you, my dear friend Juliet, for putting this on there for us. Thank you, my friend Sweet Tread. I just saw that you just subscribed to the YouTube. We appreciate you very much from the bottom of our heart. That means a lot to us, the appreciation. Thank you, my friend Cecilia, for being a new follower. We appreciate everybody who are newly following. We appreciate everybody who is tapping on that screen to give us something. Happy birthday. You are still celebrating your birthday. Well, thank you. Yes, this is my month, right? This is the month for everybody. All my February friend, all my February people, this is our month, so we still celebrating. celebrating right here. So yes, it is. Yeah, it is still my month here. So it is great, and thank you, everybody. I see so many people pushing that screen. So again, we were talking about anxiety, which is a condition that many people suffer, which is a condition that could be triggered by an event that happened to you. Maybe some people have that anxiety. It was based on an event that happens way in the past, and this is kind of the same thing that happens with people with like PTSD, which we have on our platform. We have a video that is posted on our platform about PTSD. My friend is here. I could see my dear friend Ingrid. My friend Ingrid Bent, thank you for being here, and thank you for the rose. I appreciate you very, very much. Thank you for your presence. Again, I have so many people here. Modu, how you doing? Thank you for being here. Thank you for presenting here, my friend Josephine. Last night I checked onto your other platform. I really enjoy them. Well, thank you very much, my dear friend Josephine in the house. Thank you, my friend Robin. Again, those platforms, we have to make effort to grow on these platforms. We are kind of new to these platforms, but we are trying to do the same thing, because the more we could spread this information in different platforms, the more we could educate more people, the more we could save more people. Because believe it or not, this education that we do here, it has made a very big impact. We have reached so many hundreds of thousands of people. And to be honest with you, sometimes when you have somebody who could provide some basic, again, for us, I do have a healthcare provider under this live show. I do have RN and all those. I have a lot of people here who know a lot of stuff about healthcare. But just so you know, you would not believe sometimes some of the very simple thing that people do not know. And that's the purpose of this show here. The purpose is, again, me being a family practitioner, me having the knowledge, me having to share those information with one patient, two patients here and there. Well, I'm creating this platform where right now I'm able to reach so many people, so many people. Well, I'm sorry, my friend, for your diagnosis. My friend who has that diagnosis, I'm so sorry to hear that. But yes, a lot of the time, those things could actually trigger you to start having that panic attack, that anxiety issue. Again, everybody who is tapping on the screen, we appreciate every one of you. So do you know what your blood pressure should be? Well, I do know the blood pressure should be, for an adult, it should be around 120 over 80. That would be a very ideal number for you. So usually, and again, if you are worried about your blood pressure, I always say that there's a very, very cheap investment. Again, I call it a cheap investment because it's only about $25 at Kroger. You could go, and I think a lot of the other pharmacies probably have it. At Kroger, you could get it for $25. So it's not that expensive. So you can actually buy you a blood pressure cuff, and you could check your blood pressure, especially if you have family history of elevated blood pressure. I truly recommend that you check your blood pressure very frequently. Like me, I don't have blood pressure issues. However, I try my very best to check my blood pressure as frequent as possible, because that helps me to at least check my status, to make sure if I'm going on the wrong direction, then I would know exactly what I need to do to help myself. User 36, thank you for following. We appreciate you. Meditation can help with a lot of those problem with anxiety, and this is where the therapist came in, because the therapist will actually educate you on those good measures. Thank you for the people tapping on the screen, on those good measures that you can take to actually help you manage the anxiety issue you have. And that's a great thing. That's why I always encourage people to go and see a therapist. It's no problem to see a behavioral therapist. It doesn't mean that you even have behavioral issues, but it's just that you're dealing with something. You get somebody who is looking at it at a different perspective to try to help you so you could feel better. Again, what I have seen people go from this level to way down, way down, way down. So what you need to do is to get it taken care of as soon as possible, because all these issues, the same way we talk about some of those medical issues that can take you down, that could cause you long-term issues, that could really causes damage to your other part of the body. It's the same thing. When you have problem like anxiety, like depression, if you don't take care of them, they could also lead to some very, very unfortunate events, and they could lead to you getting a lot of other issues. And if you come, like saying, let's say somebody with depression, let's take depression, somebody with depression who is sitting at home, they don't want to do anything, they don't want to move around. Guess what? That depression can lead you to having health issues. Like my friend was saying here, one health issue actually triggered her anxiety, right? So because she was diagnosed colon cancer. Well, the problem is, if you have when you have a problem like depression, for instance, and you're sitting down, you're being very sedentary, so that actually can also cause you to end up with other issues. Like now you may end up with cholesterol because you're not moving around. And some of those people, anxiety and depression sometimes can cause them to eat. They overeat, they eat, and they gain weight, and before you know it, you have cholesterol issues. Before you know it, you may have blood glucose issues like diabetes. You may have other problems, so with your heart. And so it causes a high blood pressure. And the problem is the domino effect. And this is why a conversation like what I'm having here is so essential, because when you look at a lot of the domino effect, this is crazy. Because what happens is, if you saying, okay, I'm having a little mild anxiety, I don't care about it, I don't try to do something about it, and now it leads you to sitting at home, you are depressed, and you are not doing anything, you're not moving around, and you end up with some more complications. The more complications you have, the more anxiety you're gonna have. So obviously now that you go, they tell you your blood pressure is elevated, you're like, oh Jesus, that's one more thing for me to deal with. So the thing is, the more you have problems, the more you're gonna be anxious. And that's why right here in this office, we have a weight loss program. So this weight loss program, what we don't look at just giving somebody some medicine, but what we try to look at is look at you as a person. So we look at you as a person. We look at different things around your life. Thank you, my friend Robin. That's who said so true. So we look, and this program that we do here in this office, and again, this program is most likely not for you guys because most of you guys are not in the Georgia area, but this program, what it does, it actually looks at a person. It looks at you and look at your behaviors. Again, the people who are giving us the likes, the people who are sharing, I have to say I'm very appreciative of you all. Thank you, Stephane Wells, for being a new follower. We appreciate you. So many people liking, so many people sharing, so many new people following. We appreciate that. We appreciate the support. We appreciate that people are helping us to make a difference. So we cannot make that difference by ourselves, but we have to have our friend Kelly to share this live for us to make the difference. So that's exactly what we're doing. But what I was saying is, since we were talking about domino effect, so the weight loss program that we have, we are in Smyrna. In Smyrna, my friend, that's where we are. We are in Smyrna. So in Smyrna, right off Atlanta Road, to be more specific. So that's where we are. But anyway, so the thing is, the reason we create that weight loss program like this is because what happens is, you have a lot of the time somebody is gaining weight. So then it maybe Monday we'll be talking about weight loss, maybe. So, but the thing is, you have somebody gaining weight, and then they go somewhere, somebody give them some pills, right? So they got those pills, but they take the pill, and a few days, obviously the pill will help you to lose weight. So they are losing weight, but then what happens is the behaviors didn't change. And to be honest with you, those are not pills that we can give you for the rest of your life. So what we want to do in our program, we use pills as well. So we give medicine, but then we look at your nutritional habit. So we look at what you eat, what you do, and then we look at your exercise pattern. So like are you exercising? Are you doing things? Are you trying to, because again, just the pill cannot fix it, but we look at your mental at stability. We look at what's going on in your mind, because a lot of the time people, because you gaining a little weight, then a lot of the time people are very judgmental. I think you guys know that better than I am. There's a lot of people who are judgmental just because maybe you a little overweight, just because maybe the color of you, because of how you talk. So a lot of people may just judge you just by this. So the thing is, then you are scared of doing things. Some people are scared of going to the gym. They would say, well, I'm scared when I go to the gym, they're going to laugh at me. But, I mean, as a side note, I think really we shouldn't care about what people are thinking about us. We should not let people lead our decision or our mind, because what happens, all these people, all they want to do is to control us. We're not going to let you control me. If I have to go to the gym, I'm going to go to the gym, period, But what happens is sometimes those people, they are these people, they are there, but then what happens is they are scared of doing a lot of stuff. So therefore, then they don't go to work out, then they get even more weight, right? The more weight they get more depressed. Then they sitting at home eating. Maybe sometimes the only one thing they feel they have control over is food. So then they end up eating a lot of food, gaining so much weight. Thank you for the people who are liking. Again, the people who are sharing this video. We appreciate every single one of you. Thank you for being here. But yeah, so that's why in our program here, what we try to look at, are you depressed? Do you have anxiety? What's going on in your life that is affecting you? What are you eating at home? Because again, that is the best way for us to try to help you. Because if we want to help you, we need to see where you're at. What is it that you are doing that is affecting you? What is it that you are doing that is making you sick? Really, that's what we're supposed to be doing. But the problem is, a lot of the time we go someplace, they give us that medicine and we just take it and it's like, okay, it's all good. Now, we do a lot of clearance here for like cosmetic surgery. One of the things that I always enjoy to see my queen, my princesses, they are getting this job done. They're looking great. I feel happy for them. I'm so, emotional to see the results of those things. However, one of the things that I always tell my dear friends when they come, I'm like, okay, I want you to go get this results. However, I want you to use the results that you have to motivate you to be better with your life, to be better and trying to eat better. Because again, when you see you look great. You could wear your clothes. It fits so perfectly. Everything looks so nice, everything. So then what I always tell them, it's like, okay, when you go for that cosmetic, thank you my friend Bev Cam, who gave us 8, 9, 10, 11, 14, 6, 20, 21, 23 roses. Thank you very much, my friend. I appreciate you. My friend Nicole, how you doing? Thank you for being here. Again, guys, if you just joined, just know that this show will be available tonight on our YouTube page. So if you want to watch the whole show, you could watch it on your YouTube page. Again, this is great sound. You could play it in your car. Also, we encourage that you send a link to a friend. Maybe if you need a friend to be aware of this show, or maybe of the subject that we're talking about. Again, you could always follow us on YouTube and then all the other social media platform at GoJB at Go_JB Health. You'll be able to find us. But as we were talking, when I have my friends here, my dear sisters who comes here to get clearance for their cosmetic, I always have that little conversation with them. I take a little time to talk to them, say, hey, you know what, you're doing this is gonna be great for you. You're gonna be having good results. However, I want you to take advantage of you looking good, so you can try to do better with your life. Try to do better so you don't end up with this weight again. Because what's gonna happen, thank you my friend Danny, who is a new subscriber on YouTube. My friend Danny, thank you. I appreciate you very much. Again, anybody, you could go there and continue to help us grow on our platform and YouTube. But yeah, I always tell them, use this nice job that is done for you so you could do better for your life, so you could eat better, so you could exercise more, because you want to keep that shape. But the last thing that you want to do, I do this job, but then I keep eating the wrong thing. Number one, it's not helping my health. But number two, not just that it's not helping my health, but the other thing is that before you know it, in a couple of years, I have seen it happen to some of my people where my friend Modu is giving us 8 roses. Thank you, my friend Modu. Thank you for the support. Thank you for the love. So then the problem is because the people, they don't do the right thing. They don't eat the right thing. Then what happens, they end up getting the weight back. Thank you, my friend Nicole, for sending us a rose. We appreciate that. So then they end up with weight. So that's why I always advise them. It's like, okay, what you're about to do here, it's a great thing, but you know what? I encourage for you to try to take advantage of this so you can better motivate yourself, maybe to eat better, or maybe to take better care of yourself, exercise more, maybe look at your shape now, look at how well you are, your belly is flat and all these things looking good. So just take advantage of this, not just looking at it, I'm just gonna do this and that's it. Because the thing is, the behavior, right? My friend Ingrid, who are giving us 4 roses, appreciate you. Thank you, my dear friend, who is giving us another rose. Appreciate you again. My friend Donji, good evening. How are you doing? Actually, good afternoon. It is here. So thank you for being here. Again, everybody who are following, who are tapping on the screen, thank you. If you are a subscriber to this platform on TikTok, you guys know you could always be, sometimes I forgot to talk about my subscribers, but I want to say thank you to my friend Nicole _Nicole, my friend Juliet, my friend Gay Steven, a lot of my other friends who are Stephanie, who are here, Bev Cam, one of them. So we want to say thank you to you guys, and thank you for pushing that like button. I like that. My friend Robin, Juliet, I have a lot of people pushing on the like. We appreciate every one of you. But those friends are people who are subscribers to this platform. So to become a subscriber, you just have to click while I'm live. It has to be while I'm live. That's the only time you can become a subscriber. But you could click on where it says subscribe, and you can become a subscriber. So if you ever want to be a subscriber, if you have any question, just let me know. But I would appreciate you becoming a subscriber. But more importantly, thank you everybody who are who are pushing on the like, the people who are supporting us. We are so proud of all these great people that we have. Muriel, thank you for being a new follower, my friend Muriel. I thought you were already a follower, but thank you. We're glad to have you. My period is 12 days late and I took tests, but it's negative. So if you are negative, your period is 12 days late. I mean, now the few questions that I would ask you, are you have you changed environment, or are you in a different situations? Are you under stress? All those things can affect our period because it's not as many days. So, but I would wait a little bit. If it doesn't come, then you could you could start with your primary care provider. Sometimes they could give you some medications for your period to come. But also, if it's a hormonal issue or anything, again, as I said, if you look on my videos, you will see, it's probably somebody who watched some of those videos. If you are not seeing your period on time and there's anything like this going on in your life, like stress or anything like that, so then what happened, your body is trying to tell you something, right? My friend Bev Kim, who are pushing the like button, so is you can't hear me. Somebody say they can't hear me. Anybody having problem hearing me? Can anybody hear me? So somebody say they cannot hear me. So what's going on? Can you hear me now? It looks like I can hear myself pretty well, so I don't know what's going on. So can anybody hear me? Okay, great. So my friend here, okay, you are back. Oh, I guess I'm sorry. Maybe I was off for just a quick minute. So I'm sorry, I apologize. This is technology again. It's technology, and we because of the fact that we are that's good. But okay, so most of my friends here they say they could hear me, so that's great. With technology, and especially because of how we do this here, my friend Sophia is hearing me to the point that she's giving me roses. She gave me two, now she's giving me 8, 9, 10, 11, 12, 15, 17, 19, 21, 22 roses from my dear friend. My dear friend is giving me more, another 3 roses from my dear friend Sophia underscore Olady, Sophia, thank you. And my friend Bev Kim in the house who just gave me roses. My friend Sophia is giving more roses. Bev Kim is giving me that big old heart. Thank you, my dear friend. Thank you for the support, guys. I don't know how much to thank you. And my friend Sophia just gave us another 13 roses, guys, just so you know. So I don't know how much that I have to say thank you to every single one of you. Thank you to you. To you for your support. Thank you to you for saying yes, this is possible. Thank you to you for saying yes, this is great. So really, I love all of you guys. I love the support. Again, we are trying to make this better every day. If you could tell the way you could hear me on this mic, that's already a statement that we are serious about this. That is a statement that we love this and we want to continue with it. We want to make it the very best. So this is exactly your statement right there, you know. So this is your statement. So a statement that we want to continue what we're doing because of the people who are supporting us, because of so many people giving you likes, like my friend Ivy who is liking the video. I'm sorry, guys. Sometimes it's so many things going on the screen. I don't have time to. I don't take as enough time, I think, to thank you for what you guys are doing. Like my friend Juliet, who just gave us a rose. We appreciate you guys. Thank you very, very much, guys. Thank you.
Go, go, JB, help. Go, JB. Go, JB. Go, JB. Go, JB, help. Go, JB. Go, JB. Go, JB. Go, JB, help. Go, JB. Go, JB. Go, JB.
Evelyn, good afternoon. How you doing? Thank you for being here. We are happy to see you. Again, yeah, I have my friend Mudu here already on her dance mode. So, guys, I want to say thank you to everybody. Again, we are getting close to the end for today. Again, thank you guys. Thank you for the appreciation. Thank you for the love. Thank you for the support. On tomorrow, as you guys know, tomorrow we take tomorrow off because we were trying to do this every day. So it was getting a little too hard for us a little bit because we have to be still seeing patients. Still, I mean, it's a lot of things going on. Still having to take care of the family and all that. So we're taking Saturday off. So right now we're trying to do we're doing this every day, a Monday through Friday at 1 starting at 1 p.m. So that's when we start we're trying to do this. So again, I want to say thank you to every one of you. Those of you who gave us whether you gave us likes, whether you share this video, we just being very appreciative of you for the support. We know that there's other things that you could have done with your I will visit family. Okay, so great. Have a good time with your family, my friend Kelly. Have a great time with your family. Again, tomorrow we will not be live, but we will be continuing to post a lot of information on our platform. So we're still going to be very active on the platform. We're still going to post a lot of other things. Robin, I'm the one that should appreciate you, but thank you for the appreciation. Thank you for the love. I appreciate you very, very, very much. Oh, have a nice President Day. Yeah, Monday is President Day, by the way. President Day. So Okay. I believe we're still gonna be on Monday. On Monday, I think even though it's President Day, we will be on. We know there's a lot of people that may be off, taking off for vacation or whatever, but we'll be live. It doesn't matter how many people we got to follow this. We always feel happy that we got some people that we could have this conversation with them. We got some people that we could be a blessing for, like my friend who said, "Have a blessed weekend and be blessed." So yes, go JB Health. Thank you, my friend Juliet. I appreciate you. You know that. So that's good. So it's yes, your president. Yeah. Yes, we can. But anyway, so everybody who is liking, everybody who is sharing. Thank you very much. Thank you guys. Joanne, thank you for everything you do. I'm glad that my advice was helpful. I'm hoping that I could help as many people that I can in doing these educational shows. But again, I'm very happy. My happiness is the support that I got from all these people, from all my friends, from all those supporters. Again, if you have not done so, we encourage that you go and follow us on the other platforms. As I said, on YouTube, this show will be available on YouTube probably in the next couple of hours. It should be already loaded on that platform. We try to put it there so it could be available to you. So if you guys want to go and watch it again, or if you want to go and copy the link and share it with somebody, or if you want to tell somebody about the show, but however, that person is not on TikTok or they are not live on TikTok. So that's why we try to post it there so it could be available to us, right? My friend Sophia, my dear friend and dear supporters. So I have a lot of friends here, friends and supporters. So really, I'm just very happy. Again, I'm very happy to be doing what I'm doing here. Again, like I always say, I'm not a pastor, I'm not a preacher, but I am a nurse practitioner, family nurse practitioner who is here trying. And my friend Brooklyn Harvey, thank you for being a new subscriber to our YouTube. We appreciate you. Thank you very, very, very much. We appreciate that. But I'm a family practitioner who believes in educating people. Yes. And that's what I do. And that's what I will continue to do. I will continue to teach people. I will continue to educate my population as much as I can every day. Every day. Again, if you just join, we encourage that you follow us on all our platform. Follow us right here on TikTok, but also on YouTube, Twitter, Instagram. We are on all the platform. Again, everything about healthcare education, teaching you to be the better mechanic of your body, like I always said. Thank you for the people who are tapping on the screen. That screen stays like red, red, red. We like that. We see those little heart pumping. Thank you, my friend Juliet, my friend Ivy, my friend Juliet, my friend Evelyn. I'll figure out how to send hearts and stars, etc. Well, no worry. Just know that I appreciate that you are here. Just know that I appreciate that you are here. No worry. But I do have a lot of people tapping on that screen. I appreciate every single one of you. Thank you for being part of this today. Georgini, thank you for being a new follower. We appreciate that you are here. Good morning, good afternoon, good afternoon, my dear friend. You see, I'm so happy to see you that you make me my dear friend, Miss Lee03. Thank you for being here. I'm so happy to see you that I'm saying, instead of saying good afternoon, I'm saying good morning. So, but unfortunately, you come in at the end of the show. We are going to load the show on our YouTube page. So if you have not followed us on YouTube yet, you could go and follow us there and subscribe there. But also, you could go there and be able to watch the past shows and also the show that is coming up. My friend Evelyn Lewis. Thank you, my friend Evelyn Lewis. It's my pleasure. And my supporter, Juliet underscore 1LPN. Thank you, my dear friend, my dear supporter. One of my very devoted supporters. You as well, my friend Bevcam. May you have a blessed day and a great weekend. And I hope everybody has a good weekend.
Go JB, go JB, go JB, go go JB, help, go JB, go JB, go JB, go JB, help, go JB, go JB, go.
My friend Joanne, thank you. I appreciate you. And Sophia, my dear friend, who gave us so much support today in this life. Thank you very much for your support. I appreciate you a lot. Very, very much.
Go JB, go JB, go JB, help, go JB, go JB, go JB, go JB, help.
Well, guys, it was really a pleasure being with you today. Thank you for letting me serve you today. Thank you for letting me advise you today. So it was a pleasure. I was happy to be here. Everybody have a great weekend. Be safe and continue to live a great health. That's what I preach. That's what I want for every single one of you. Again, if you have a question, let me know. You could always go under my videos to post a question. I try to answer all the comments on those videos. Again, even though I'm not gonna be live tomorrow, but please you could always go on all this platform and all the social media. I always have good stuff, good educational content. Thank you, guys. Thank you for sharing us. Thank you for telling people about us. Thank you for subscribing us everywhere you see us. Thank you for liking us everywhere you see us. But more importantly, thank you for the people who are subscribing to this platform here. And also thank you for the people who gave us so much gift today on this very good show. Again, y'all go and have a great weekend and good health. Thank you.